Hey guys, welcome back to the channel. Today, we are going to be discussing the question, do heart stents even work? Most cardiologists' heart doctors go to the large national meetings that are sponsored by their societies. Since all the cardiologists are in one place, it would seem to be the perfect place to have a heart problem if you're going to have one. Conversely, it would seem like a terrible time to have a heart problem anywhere else, since all the cardiologists are gone. So, they did a study to see how people did when they had a heart problem during one of these meetings. To their surprise, people with heart problems during the national meetings were less likely to die. How does this make sense? Wouldn't cardiologists be able to help people survive their heart problems better? Maybe what the cardiologists do is actually more harmful than beneficial. It seems there were similar results in Israel when doctors went on strike in 2000. So many people were unable to see doctors or have surgery during the strike, and yet death rates went down. When looking at other periods when doctors went on strike, the results were all the same. Death rates either stayed the same or went down. Many current medical treatments offer no benefit to the patient or are more harmful than they are beneficial. Doctors themselves will admit that about 1 in 5 medical treatments are unnecessary. When medical groups looked into this, they found 5 treatments with either no benefit or more harm than benefit. For example, give antibiotics to people with a viral infection like a cold or flu. The antibiotics don't help and can actually make things worse. Another treatment on the list was angioplasty and stent placement. This is the practice of unclogging clogged heart arteries and putting a sheath inside to keep them open. When heart arteries become clogged, the heart doesn't get enough blood and oxygen, which can cause chest pain. If the blockage is bad enough, it can even cause a heart attack and death. The heart needs blood and oxygen to be able to work. It seems like common sense that opening these clogged arteries would be beneficial to patients, as it would allow more blood to get to their hearts. In fact, this is a standard and very common treatment for this situation. It is called angioplasty and stent placement. The cause of these clogged arteries is mainly related to poor diet and lifestyle choices. In fact, a whole food plant-based diet is the only intervention that has been shown to reverse these blockages in the heart arteries. For those who are unwilling to change to a whole food plant-based diet, options include taking medications in less severe cases and open heart surgery in the most severe cases. During surgery, the chest bone is sawed open so the heart can be exposed. The clogged arteries are identified, and they are bypassed. The most common intervention is to try to avoid surgery, and rather unclog the arteries using thin wires that are placed into the heart arteries, and are used to open them up, using balloons that spread the clogged arteries open, and slash or stents or sheaths to keep the clogged areas open. During a heart attack, these procedures can save the patient's life. But so many of these procedures are done on patients who have heart problems, but are not having a heart attack. This can make their symptoms better, but doesn't make them live longer. And people don't know this. Then, they did a study where they did the procedure to unclog and put a stent in the patient's arteries. But, in half the patients, they did the whole thing without actually putting a stent in. Unbelievably, the stent patients and those without the stents had the same results. So these stents don't help with symptoms, they don't help with heart attacks, and they don't help you live longer. But one of the side effects is death. Maybe we should only be doing these procedures on people who are actually having heart attacks, where we can do some good for the patients. Why are we doing these procedures on thousands of people who are not getting anything out of it other than the risk of having a very invasive heart procedure? How do doctors justify doing these procedures? What do they tell patients when they sign them up for the procedures? Why don't the procedures work anyway? Anyways, don't forget to like, subscribe, and share. Thanks for watching.